I'm Jeana Bracey. I'm the Director of School and Community Initiatives at the Child Health and Development Institute. And I'll tell you a little bit more in a moment about who we are and what kind of work we do. I want to give a chance for my co-presenters to introduce themselves as well.
Hi, I'm Michelle Middleton. I'm the Chief Academic Officer of Enfield Public Schools.
And I'm Joanna Fornwalt. I'm a social worker for the town of Enfield Youth Services.
Great. So what we're here to talk to you about today is the SHAPE system. And most people say, what is the SHAPE system? So if you learn nothing else before you leave here today, hopefully it's that you can say what it is. So we'll be telling you what the SHAPE system is, why you might want to use it, and we hope that you leave here, that's okay. We hope that you leave here really excited to get into the SHAPE system yourself. So my colleagues here from Enfield have been using it and or have used it and entered the system and have some great things to share from their personal experience. So again, those are kind of the goals of what we want to share with you today. The presentation we're going to give is really adapted from the University of Maryland Center for School Mental Health. They're the ones that have developed the SHAPE system. It is online, it's a free interactive system, and they have a SHAPE 101 presentation. So much of this presentation is really about kind of what does the system actually look like and how do you use it. So there are, I think, 77 slides or something in this presentation. Obviously, we're not going to spend a lot of time on each of those slides, but we wanted to put them all in here for you so that you can access them on the portal for the conference and you would have actual screenshots of what the tool looks like so that when you go back to use it yourself, it'll look familiar and you'll know that you're doing things the right way. So back to sort of who we are at the Child Health and Development Institute, or CHDI. We are really a statewide independent nonprofit organization for children's health, mental health, and primary care. And what we do is really around research, policy, and systems development in the state of Connecticut. My area, I'm in the mental health area, so my training is as a clinical community psychologist. And we do a lot of sort of systems building work around capacity building, infrastructure development, program evaluation, implementation of evidence-based practices, those kinds of activities with schools as well as with provider agencies that serve children and families around children's mental health. So one of the primary pieces of my work, particularly in the school-based mental health area, is around the School-Based Diversion Initiative, or SBDI. It's that second square there. So some of you may have heard that or may have had that at your schools or districts. And so most of the times when I'm coming here to present, I'm presenting about that. I'm not going to get to talk about that today. So, but if you're interested, let me know. So we have a range of folks in the room. It sounds like a lot of social workers, special education folks, and some administration as well. And the only one person that knows about SHAPE. So besides these, two up here. Okay.
I didn't know about.
Nope. Doesn't work.
I didn't know about SHAPE either until October of 2017. So this is not, and now I'm here talking about it. So that should tell you how user-friendly it is.
Yeah, and that's what I was I mean, we've done one thing right. At least maybe we got the title right, or some people got into the room even though they have no clue why they're here. So that's a good thing. They wandered in, and maybe it's the only one with space. I don't know. So we did something right to get you here and get you interested in it, which is a good thing. And so hopefully you're thinking about school mental health either at your school level or at your district level, and at least that got you excited and interested to learn more. And I myself am not a SHAPE expert by any means either. I learned about it, I want to say I first heard about it, it's going on about 2 years ago now, I think, and at a national conference for the Center for School Mental Health, who was just debuting it really kind of nationally at that time. It had been piloted in a few places, but it was really just kind of growing and gaining some speed, and have very quickly gotten to learn more about it just in the past year. And so am really here kind of somewhat as an ambassador. I don't get any money from the SHAPE system for promoting it. I don't work for them, but we'll tell you a little bit about our role and sort of how we're connected with that in a moment as well. So, like I said, one thing we want you to leave here with is what is it? What is SHAPE? So here's a quick overview of what the SHAPE system is. So SHAPE stands for the School Health Assessment and Performance Evaluation System. So SHAPE is an acronym, of course, like everything else. And really what, at its core components, what it is really kind of an online, interactive, free portal that schools and districts can use to both kind of assess where you are in terms of school mental health systems, what components do you have already in place, what kinds of things are you doing well, what kinds of things could you use some support with, how do you get resources about those. It also gives you an opportunity to create your own profile at the school or district level, so you can see, what are you doing already with respect to school mental health, what does it mean to you at the local level, and then how can you use that information moving forward to improve things where you need some work. It is hosted by the Center for School Mental Health at the University of Maryland, and it's also funded in part by the U.S. Department of Health and Human Services. So, and one of the things when we talk kind of generally, you're thinking about back to the keynote this morning even, and some of the things that she mentioned that one, is in the context of classroom behavior management, right? But if you kind of generalize some of her ideas, reactive approaches don't work, right? So the more that we can plan, prepare, have a comprehensive, coordinated approach to doing school mental health more broadly, and which includes discipline and all of that as well, that we're more likely to have better outcomes, smoother process. It's going to feel more comfortable for all of you that are doing the work, and ultimately it's going to give you better outcomes. She mentioned some things like using screenings, so mental health screening to identify problem areas for individual children, looking at integrating prevention, health promotion, early intervention models, also using evidence-based practices, so specific services and supports to address student mental health. And so all of those things are actually components of what the SHAPE system can offer and can help you identify in your own system. We think of some of the questions that you might want to know about. So do you know if you have, would you be able to say, like, yes, we have a coordinated school mental health system at our school or district level? If you think about what that means to you, do you feel pretty confident that, yes, we do? Or do you feel like, somewhat, but we need some work? Or is it like, no way, I'm completely overwhelmed, I don't even know what that would mean. And so kind of that's another way to kind of orient yourself to what this is all about. Do you know things like who in your school has information about community-based services, or who's providing services in your school? Do you know how many kids were screened for behavioral health condition in the past year? Do you know of those kids that were screened, how many were referred? Have you ever thought about, wow, I work at the high school level. It'd be great if the staff and the system at the elementary level would really prepare kids, and with respect to social emotional learning and development and those kinds of things before they get to high school, and our job would be easier? Or do you think we're at the elementary level, and boy, if the middle school and high school would just sustain some of the things that we put in place, some of the really good things, things would be differently as a child progresses through our system. So again, those are the kinds of things that kind of orient you to our talk today. And we are keeping this pretty informal, so please feel free to jump in if you have questions at any point, and they're going to jump in with thoughts as well as we move along. So what would you use the SHAPE system for? So schools and school districts can use it to really sort of capture the landscape of school mental health nationally. So one of the pieces of this work is just getting a census of who is thinking about or doing school mental health nationally. And this is really the first time, this comprehensive system is really the first time since about 2005 there was a study done around kind of in that vein, a census of school mental health to kind of document at a systems level who collectively is working to identify needs and strengths and drive systems change for school mental health. And so again, this is something that's been over the past couple of years really growing and gaining momentum. It also helps you kind of document your service array as well as your staffing, and it really takes the multi-tiered systems, services and supports approach. It helps you develop your own profile, so you develop a school profile or a district profile, and can really kind of identify what your staffing level is, what your strategies and activities already are. And it also houses, the system itself houses the national school mental health performance measures. So though we're going to talk mostly about those, there's a quality measure and a sustainability measure that can really help you kind of dig down a little deeper and figure out where things stand in your own area. These screenshots show some of the customized reports that come out when you enter the system. And again, we'll talk a little bit more about what those mean in just a moment. And the website's here all along, so you can, of course, go directly there at any point if you have a mobile device with you. And here, this, again, is more from the website, which shows you, just highlighting kind of where the school quality indicators and the sustainability indicators. It kind of helps you identify what exactly would you be looking at, and we're going to go through those when we get to the tools themselves. But there are free resources, and again, kind of the census to kind of jump in and be counted. So why would you want to use this at a district level, right? So, oh, I'm sorry, my notes are not matching where the slides went to. I feel like this is the keynote over again. Did it go without me? No. So once you populate the system, once you create a profile, it will actually give you your own kind of page to where this is a UP school district, and it gives you your own page where your own resources will kind of pop up in there. And we'll talk more about like how you get to that point. The SHAPE system is actually a recognition system. And so it helps you kind of get step by step through the system by earning stars, right? Because everybody likes positive reinforcement, and we're motivated by gold stars, right? So the first star is the blue star, and that's simply just joining the system. All you do for that one is really just kind of log in, get a username, and you get your blue star on the map. Again, that's helping to kind of populate that census, right? The bronze star, I always want to say red, but it's bronze, is where you fill out the school mental health profile. And so that is where you're going to answer just a few other questions. I think it's 11 questions total about your school or your district, and that helps to kind of identify your resources, your staffing, your service array. We have the silver star is the next step. You can earn a silver star in two ways. You can fill out the quality assessment or the sustainability assessment. And if you do both of them, you get a gold star. And so that's kind of how the recognition system works. And really the goal here is, again, thinking, from the SHAPE system's perspective, is this national movement, right, towards quality improvement, accountability, and excellence. But really what we want to talk to you more about today too is how to use it on a local level. Once you enter your data in here, what do you do with it and what's really important about it? You can add team members in your profile. You can create the census. You can also access the targeted library of resources. Yes, question. Yes, Melissa.
So in terms
Yes.
of having the availability to log in there and create
Yes.
a profile, what are the credentials required for that?
Yes, that's a great question. So what are the credentials required to go in and create a login on the SHAPE system? So, oh, they're out of order. They are here, sorry. So I have a slide on that. We're getting there. So if you get to the SHAPE system, actually here. So here is really, that's the website and where you would log on. You go to that Join Now button, and that's where you click on. And really you don't need any particular credentials to be the person to go in and enter information on the system. So we're going to talk a little bit more about the implications of that, because there are questions about that, right? And honestly, when I was in the national conference and it was debuted, and they said, everybody right now, it's in their slides as well, like, this is your call to action. Go to your mobile device, go to Join Now, and sign in, right? And you can do it as a parent of a student in a district. You can do it as the superintendent. You can do it as a social worker, as a teacher. Anyone who's connected to a particular school or district can go in and join the system. At first I thought, okay, that sounds great. Like, I want to be part of the system. And I go in and you start answering questions. You're like, well, I don't know that I'm the right person, as a parent, to be the voice of what my district's information is that goes into the system, right? And so, yeah, so I think they've stepped back from that a little bit in terms of how they describe it. They still encourage everyone to enter the system, and anyone can use the system, but it's definitely a team-based approach. And so the goal is to create a team of folks who are going to be entering data and information to represent the school or the district. But it doesn't require any particular knowledge or skill to use the system itself. It's very user-friendly. It's all point and click online. And again, we'll show you some more of that. But you do identify yourself as a representative of the district. And so as we've been working with schools who have used this, we get a report out from them saying like which schools have entered the system or created a profile. And we go through the school and we've reached out to kind of lend support, like, oh, you have a blue star. We would like to help you get to bronze or silver. What can we do to support you with this? And, oh, well, who entered, the information? You give them a name, like, I don't even know who that is. That person is not authorized to give information on our district. So, so that is one of the things. I think, the Center for School Mental Health, they value that aspect of the system, but it does create questions in terms of is that the representative that you want for your system? And so it does give you the contact name. You can go in there and contact that person yourself and say, hey, I saw that you signed up for SHAVE. Who are you and why? But it creates the conversation about, let's develop a team and let's see who's in here. And so that, you might, I was going to say, go ahead and check and see if you're already in the system. You might want to know that as well. Jump in.
So the way we did it is we were having a lot of conversations, I'm sure other people are as well, about mental health and behaviors and trauma in the classroom. And so we found that the school district and the town were working parallel to each other. So we had a conversation in the fall about pooling resources. And one of the first things that we did is the town was looking at the SHAPE system. So they identified some people. They identified myself. They identified one of our special ed coordinators, our pupil service director. Who else from my district gave? Then some people from the town, because we were answering it as a district, but also as a town. We're looking at this as a whole service piece. And this was a first step for us in figuring out, we don't know what we don't know. And we know we need to do something, and where do we start? So this is kind of like a starting point for us, where now we're taking this as one piece of information and completing a mental health audit that will have an action plan that we can priority step. So hopefully next fall, we'll be working on the first steps of those priorities because our audit should be completed. I'm the taskmaster, so we're pretty close to done. We should have all the information into the people helping us put the report together the end of this school year, which gives us the summer to write the report and begin some work on it. But it scares me knowing what I answered, that other people can go in and just answer. So if you're going to use this for any moving forward or really, really looking at where you are, my suggestion is getting a group of people together, and it's got to be a diverse group of people. Because I couldn't answer every single question. I had to send Joanna to 2 different people because there were some special education questions I didn't know the answer to. Actually, I think I sent you to Pat West as well. I think there was a question about financial as well that I couldn't answer.
So there is only one single document then? Like you're talking about the Silver Star, this survey or the sustainability survey. Once it gets filled in, that's all that can exist for that school district as it stands right now. I would imagine it'll keep evolving, but.
Yes. So,
No, go ahead.
Oh, I was going to say, well, I think to clarify too, we're talking about a few different things too. So the profile are like 11 questions that just kind of who's your district and, generally do you do screening? Do you offer services in-house or do you, do referrals to community-based services? Like yes, no kind of questions. And so that there could be, that part doesn't necessarily have to be done as a team. The school mental health profile, it's always good if it is. You want as best informed information that you can get. But realizing that people that answer it from different perspectives will likely answer it differently, and that's okay. That one's just kind of a general, like, yes, we're doing some great things, or we're doing some things, and maybe we're doing everything, maybe we're doing nothing, but we're here, we're in the system. Once you get to the actual tools, the quality and sustainability tools, which get you in that silver star range, that is where you definitely want to create a team. You definitely want to, you can print the information out in advance. The questions, you can fill it out, on paper and then have someone enter it into the system. You can sit together as a team and discuss it and enter it as you're going. But that one would then give you your record, kind of the tool that would go into your toolbox, so to speak, the completed measurements. And you can repeat it as often as you want. Generally annually is a nice time to do it on an annual basis, but you can do it as often as monthly, quarterly, every other month. And so you would have that information there that of course would be starting to compare itself to previous versions. So if you have a version that someone just kind of randomly did, beforehand, you would want to make sure that you're building off of that. And we'll talk more about that as well.
Yeah, I was going to say it probably somebody who is just, kind of didn't have the information, it would be difficult for that. They would get to this and they'd be like, I think I'm going to stop. It's not like there's a lot of information that's very specific that you would need.
Right.
And I was also going to say, there's a lot of everybody's school folks here, and I'm town, and we sort of talked about how, this isn't, schools can't do it alone, right? So there's a lot, you're basically de facto mental health providers now. And so for us, we have already established a pretty close relationship between our town, youth services and social services, and our schools. So this kind of is just an extension of that. But I think that it works nicely because, it really does have to be that the community cares about this, not just that the school cares about it, right? So just to throw that in.
No. Now, as soon as you can see some quick pictures real quick of what the questions are. So school mental health systems can be counted in the system. You want to be at a district level or a school level. Click one button. You select, it's a drop-down menu. You select your state, your district, your schools will populate. These are mostly public schools at this point. You can have your school or district added if you don't see yourself on here and you want to participate in the SHAPE system. You contact them. They have fantastic customer service. They're great people and technical assistance. And there's a link on there somewhere that actually says, if you don't see your school or district, click here. Does your school mental health system have universal mental health screening and assessment? Yes, no, not sure. So you do have the option to say, I don't know. Of course, you're only going to get as good of a report and information back as you put in the system. If everything is I don't know, you're going to get a blank report saying we don't know how to help you either. Does your school mental health system include universal mental health promotion services and supports at the school or grade level tier 1 support? What do you feel you need? And there are a couple questions that I skipped there. That's number 5. I'm skipping up to number 11. What do you need to be ready to register your school or district on SHAPE? So this is the profile level again, the bronze star. Nothing, I'm ready to go, or I need more information about whatever it is, or I need a team to help me because I don't know all this information. And this just helps give them kind of target technical assistance to you if you need it moving forward. And congratulations, now you've got your bronze star, right? And you're ready to build your team. So I want to point out a couple things, other things on the website that kind of go along with that question too. One is about privacy. So who can access the data once you put it in there? One of the things, so we, again, our role at Child Health and Development Institute, we are part of a team here for the state of Connecticut that has received a technical assistance grant from the University of Maryland Center for School Mental Health to get SHAPE entering the SHAPE system. There's no money involved with it. It's just free, really great technical assistance and support. People to hold your hand and walk you through the tool if you need it. And then, as we're going to talk about too, what to use with it, how to use it after you have your results. Now what? What does it mean? We can't access any of the data without you indicating your team members. So when you enter your team members, you put in a name, you put in an email address. Only those people on that list can see the actual information that you enter, can see your reports, can see any of that information, can even see that you've entered the system. So you do need to, if there are people on your team that you want to be on your team, you need to include them. And if you want to be able to share the information, you have to put that in there. There is a checkbox. I have a screenshot on there somewhere. It's not here yet. But if you're doing it at the school level, there's a checkbox that you can click to let your district see your data as well that you enter at the district level. It's by default not selected, so you have to opt in and say, yes, I want my district to see this as well, if you want that. They also have a lot of FAQs. These are updated regularly, and once we got on board, once Connecticut got on board, again, this is a partnership between the Department of Children and Families, with State Department of Education, as well as the Injury Prevention Center at Connecticut Children's Medical Center, together with Ph.D, that's providing the support in Connecticut. Once we got into the system, we had a lot of questions. And so I actually went back, and some of these FAQs that are at the top now are the ones that we submitted. So they really do put new ones up there all the time and give new answers, but some of those would be helpful for the kinds of questions you're asking as well. You don't see your school, how do you get it on there? It says an account is already created. What do I do about that? If you don't know who it is, contact them to get connected and join the team. And others. And they have the categories there are around using the SHAPE system itself. They have categories around the actual assessments. They have more information about their partners and school-based health centers as well. Please.
11 questions.
Yes.
Is that the profile?
That was the profile.
So, I don't know what you skipped. We could be questions with lots of letters after them and whatnot.
Not a ton of detail, no, not in that level. Yeah.
Right, and then so I guess how much information can come from that?
Mhm.
And the second thing,
Right.
the second is sustainability and quality.
Yes.
Do we have an example of what that looks like?
Yes. That's where we're going next.
That's where you
Yep.
Thank you.
That's where you get your information.
That's where the most of the bulk of the information is. Yeah. So I kind of think of like, you know, the join now is like, oh yeah, sure, I'll sign up. I'm part of the crowd. And then the testing the water is like, I'll dip my toe in and do the bronze star and, you know, do the profile. And then the silver star is like, okay, I'm all in. I'm going to spend 2 hours on this and do a full assessment. So again, it starts off exactly the same way as you did with the profile. You select your school district, you drop down menus, create your account. You should already have one. It'll pre-populate if you already did the profile, you're already in there. Then you get to your team members. And this, I'm gonna spend a couple minutes with you all talking about the team members, right? So this is your virtual workspace here. And so it has all the tabs there. This is a really important piece. And bless you. Identifying who your team members should be. And so, you know, we talked about who should have access to this, or who do you need to have access and support you in this. And so thinking about what are the key roles. You know, do you need an administrator? Do you need your pupil personnel person? Do you need a social worker? Do you need special education staff represented? Who has access to the information that you need? So maybe it's not necessarily any of those people, but it's a data person at your school or district that has access to the information. And maybe you know who has the information, but you can't get it yourself, so you bring them in to get the information you need. And who has decision-making ability, because some of it, as you go through, and you can talk about your process, a lot of what we talk about, the process of this is what's really most important. It's really when you see what you know, what you don't know, and who has the information. And so being able to kind of think in the moment and say, okay, we're going to answer it this way, and then in future administrations, we're going to answer it this way, so that you're getting consistent data across time periods too. Because of course, this is a tool developed nationally. It's a one-size-fits-all approach in terms of the questions. And so you want to make sure that they make sense for how you're actually implementing it.
There's a couple ways to do the teams. Like I firmly believe that you need a group of people. I'm so short, I'm going to stand up. I see people trying to see me and they can't. You need a group of people to answer the questions. They're like, when I sat down with Joanna to do one of the reports, you're kind of rating yourself on a sliding scale. And I'm like, I don't know. I think we're pretty low, but do I say we're pretty low? Like, so you kind of need more than one person to give that information, looking from different perspectives. But with the account here, so we had more people involved in answering the questions than Joanna, God bless her, went in and put everything into the system. But correct me if I'm wrong, I think the only people that have access to our reports in the system are myself, you, and Jean, correct? So Julie, so that's right. There's only 4 of us that actually can go in and look at the reports and be in the system at this point right now, but there were more people than that involved in collecting the data, if that makes sense. So you can talk to somebody like your data collection person, but they don't necessarily have to go in here and have access to all of this. It just depends on how you set up the process. And that's kind of how we did it. Joanna was trying to save me time, so she sat with me, and then then I'm like, well, I want to get in the system and I want to see everything. So it just depends on how you're going to use this system and who you want to be able to go in and see, because we're having conversations. We have a whole committee task force that we have going on with members of. We've got youth services. We've got Board of Ed people. We have a Board of Ed member. We have a town council member. We have a pediatrician from town that are meeting pretty much monthly to kind of gather information, next steps. So they're all in the process, but they're not all in the system. Okay?
And just to clarify, you can get all of the reports out of the system too. So you can't just, you can print them out, you can email them, you can share them out of the system, so that you can give them to whomever you want to once you've completed them. And I want to clarify too that when again, there's the selection tool if you want your district to be able to see it if you're doing this at a school level. If you do it at a school district level and you give, or if you're at a school district level and individual schools have allowed you to see their data, they will pop up here in your profile. When you log in, you have access to, they're there. If no one's giving you access, there's nothing there. And so that's the difference of how it shows up in your system. So you don't know that those schools have even done the system or that they're in there unless you've been given access. As well as the resource library. So even the tools that pop up related to what their needs are or gaps are not going to show up in your access unless you've been given access. So here, that's where you print a blank version of the form. You can print it out, and you can also do it in spurts. You can save and continue later on. One of the things about completing it, it encourages you to do it for the last school year. So actually this time of year, the end of the school year, is a great time to do it for this year that just happened, or in progress, because you have a full year's worth of data and you can then compare for next year. It's great to help you plan over the summer and strategic planning and thinking about, what kinds of things can you improve for next year. So this is actually a good time to think about the SHAPE system. Again, here's the quick information about entering team members. This is all you need. Name, title, email address, and phone number to put somebody in your team. You don't have to need a lot of detail. This is the schools that you serve. This is a district level survey here. What are the components of the comprehensive school mental health systems? So it's checking to see if you meet all of those sections. The sections are domains. Actually, this is still the profile piece. So let me get through the profile piece. Attendance, grades, do you collect any of this information? Yes or no? How is it used? Here is your professional team. So what is your staffing? Do you have all these types of staff members? And then a little more detail in terms of FTEs of staff per type. This is around, do you provide any of the services and supports for the following students? So here's tier 1, tier 2, tier 3. And then it's going across specific diagnoses or conditions or behaviors. So anxiety, nervousness, phobia is the top line. Do you provide tier 1 service? Oh yeah, I forgot to have a little nice green thing. Here we go. Anxiety, nervous, phobias. Do you provide tier 1 supports, mental health promotion and prevention? Do you do selected tier 2? Do you do tier 3? Do you refer outside to community providers not in the school? Or do you have no services for this student concern? So you go through and you enter for yours. Once you go through, again, this is the profile piece of this, and you move on to, let's see, this is like it's behind. That's the profile. You're moving on to your next step. This is the report that comes out for your profile. So it tells who you are. Congratulations, you're in the census and you started it. Here is some of your data collection information. So do you collect attendance data? Do you use it to identify students at risk? Do you use it to match students to services? Do you use it to track individual students? And do you use it to monitor, evaluate outcomes? So those are the types of different data systems. This is what they've reported on their, which pops up in their report. There's their staffing. Here's the tiered, multi-tiered services and support. So it tells you which ones. If you have green, then you say you do it at tier 1. If you have yellow, you say you do it at tier 2. And so you can kind of visually see. And again, I mentioned that we have support here in Connecticut to help districts and schools get to Silver Star status. So this is the plug now. Everybody sign up. We want everybody to do this. And again, going back to look at like what's in it for you, right? So not only do you get a sense of what are the great things that are happening at your local level, and how can you use this for planning, for implementation, for support, for outcomes. We've seen districts use this for getting funding, applying for grants. You can say, look, we're paying attention to our mental health system. This is what we know we're doing well on. This is where we need some help. We can, and thinking from my perspective, kind of at a statewide level, one of the goals that we're really working on is creating a comprehensive framework for school mental health statewide. Right now, as we know, Connecticut is the land of steady habits. Our 169 cities and towns, our 206 districts, and our 1,026 schools are doing things differently. And so we need at least some framework for what does school mental health mean, right? So wouldn't it be great to be able to come to a conference like this and say, hey, yeah, I know what school mental health means. I'm doing this, this, and this. Say, oh, of course I am too, because we're all doing the same thing, right? We all know what it means. and to be able to provide support to each other in terms of where, it provides a common language, right? So they're all good things, I think, that can come from this once we start to build kind of an awareness around the benefits of what this kind of system can do, just to help kind of identify what we need to work on and how we can work better to do that. Yes. Jump in.
I saw you got a grant to help 20 school districts.
Mm-hmm.
How many of those school districts have you built?
We can go, so our benchmark, we have to get 20, we can get 200. We have capacity to get our grant. The grant, again, is not money, it's just technical assistance. So we have time, that's all we have to offer you, but we have time and folks who are passionate about it and folks who have done it and who can kind of, help sit with you and say, here's how do you make this decision point, or how do I use it afterwards. So we have to report back July 1st how many we got, but we're continuing to do this. Again, it's not money anyway. So we have the internal capacity now to be able to provide the technical assistance for anybody. Well, if like 300 of you come to my door tomorrow and say, we want to do by July 1st, we'll have to think about it, but we will do our best to make that happen. And even group-based, regional-based, it can be one-on-one. We have lots of ways of providing support. So yes, I'd say if you're interested, just jump in.
I was going to say that's how Enfield got even involved, that found out about SHAPE, was because we had been having some communication with CHDI, and then they reached out to us and said, hey, we have this technical assistance grants. Would you be willing to do this? And really that just sort of lit the fire under us to do it, right? So somebody calling and saying, we have this opportunity, and then checking in on you periodically really keeps you on track. So that was, otherwise we didn't know about it before this.
Yes, question.
So I wanted to coordinate something like this.
Yes.
For an initial
Yeah.
visit.
Yeah.
Would you come and sit with us and do the initial profile? And how long should I allot for that first meeting? What kind of time frame is that?
Yeah, so we can do it different ways, and you might say what would be helpful in terms of time. It kind of depends on just where we are with that week or day. The profile itself, again, doesn't take very long at all. It's really kind of the buy-in process that may take longer. So it's like, if it's just you and you're like, already I have the background, I'm kind of into it. Yeah. So that's, we could sit through the profile and do that in 30 minutes. If you come ready to do it, if we come and say, okay, now convince me that this is important. Now let's talk about what exactly do you need from me, and let me think about, So, and the tool itself, once you get to the quality and sustainability tool, I think, that's a longer time. Yes, getting you to the silver star. So we would sit with you to get the bronze star and the profile. If there's a commitment that you're going to move forward and do the silver star, do one of the tools.
Everybody's really busy. So
Absolutely.
I have to make the best use
Yes.
of the time.
Yes.
So if I can move forward and say,
Yeah.
yes, we will have something if you can give me 2 hours.
Yeah.
Then
Yeah.
that's
And
something.
I think what we recommend is that you go in, that maybe you or somebody, you pick one person that can maybe do the profile already on your own, and then you can get to the point where you can print out the quality tool, and then you can even look over that yourself and say, okay, I can answer all these things myself. I need this person for that. I need that person for that. Or I don't know about, do we want to answer this question? I don't know. It's just sensitive. You can go through it and see where some of the questions are, and that's where we can really provide more targeted support around kind of how to get through it.
Yeah, I think that so youth services had the initial contact with CHDI, and so then we approached our superintendent and said, hey, can we do this? It's free. But then again, Michelle's an incredibly busy person. She's very important, and so she but she has all the information, so we need to meet with her. But so for us to just say, we're going to do all the inputting of the information. We're going to just, what time is convenient for you to meet with us, and then we'll go back and we'll do all of the, kind of the entering of the information, so that we're getting her knowledge, but we're not taking up too much of her time. So hopefully that was helpful.
The other thing too is like Jeana said, printing out these reports first, because if you look it over, I couldn't answer every question on there. I didn't have capability. So Joanna kind of said to me, okay, we're going to be talking about this, 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 and this. And she actually sent it to me in an email beforehand. So I was able to look it over so I knew what we were going to be talking about. So I think we sat down for maybe 45 minutes to an hour. But then at the end, I said, okay, I'm going to put you in touch with, Julie and Pat and these people to get these. I was able to tell her which questions to go to which person. And it kind of cut down on that. So it really was a team thing, but it doesn't take like a 5 hours, but you really need to know before you sit down what you're going to be looking at in order to get the information correctly.
And I think, again, that's the process is so important. And so doing it the first time, it is going to take that amount of time. And again, to make sure, well, when it asks about screening, do we count this thing that we do over here? That's how we get information. It's not necessarily an evidence-based tool, So you go through some of those discussions, and then once you've made that decision, document that about what did we include in this question. So next time you do it, you'll know, okay, yes, here's the information that goes into this question. So that's, again, kind of some of the upfront piece. Yeah.
Some of the concerns, and I know this gets sensitive for certain, whether it's individuals or conditions or whatever, but the accessibility or the demand that someone revealed at, let's say that, Texas school district, they know this exists somewhere and they want to see, after an event.
Right.
Can they be forced to provide this material out to the public? Does it become like
Is it FOI? Well, and their response is that it all is anyway. It's just not in one place. So this might make it easier to say, oh, here's your staffing, and here's what you're doing with that level of staffing. For example, we had people ask about that. Well, could we be at risk for getting some funding pooled if we say, we have all of these people and they're not meeting the need.
It's more of an evaluation of systems.
Yeah.
And so you're not really drilling down into, these 3 kids were served this way. It's like, do we have tier 3 interventions? Do we have tier 2 interventions? And yes, it does talk about staffing, like how many FTEs do you have in, a social worker, but that could also be really helpful in budget process. Yeah. If you're a school system that the town is talking about behaviors and mental health, and you're going in and asking for a social worker, it would be, it's irrelevant information. And quite honestly, if somebody wanted to, they could get it anyway. But it's just putting information in one place for yourself so you can see where you're doing okay and where you may need some work. Because if this is a huge undertaking, when you talk about, building a system and dealing with the trauma and the behaviors, where do you start? So where we're going to start is where it looks like we don't have much. There are places we can build upon things. But there are places where we're like, we have to start here, because this is a huge gaping need that we just identified that we don't have. So that's kind of what it's more about. I guess they could ask for it, but it's really not giving them, if they have kids in the school system or if they talk to anybody, they know like we use PBIS. They know we have PBIS. Sometimes you could, on the district, on Ed site, they can tell you your expulsion rate. That's out there. So I don't even think they ask that on this. So it's just, it's just kind of putting things in place so that you can analyze it.
And that's a question we can always go back, if you contacted us, we can contact the folks at, at the Center for School Mental Health and get more clarity around other districts or concerns that might have come up around that particular issue. Yeah.
Yeah.
Sure.
It could be.
Yeah.
Yep.
Yeah.
And then even how data is entered, because we all have experience where data is manipulated in order to create a scenario.
Yeah.
So if it's going to truly be clean, then we all have to be honest.
Right. Exactly. And that's the point. Yeah. Right. I just want to clarify the sections too, the domains, when we get to the quality indicators. So the indicators include teaming, so who's doing the work in your buildings, needs assessment and resource mapping. So how are you identifying what you need, what things you already have at your disposal and are you using. Screening is another one. Evidence-based practices, evidence-based implementation, so kind of how well and fidelity of how you're doing those, not just do you have it or not. student outcomes and data systems, and data-driven decision-making. So just wanted to make sure that you know that when you put in your team members, they do show up on the first page of the report. So that's another thing to keep in mind if you're thinking about, again, good way or bad way, but it would be identified. And then, again, here's where you start with the teaming. And so there are 12 pages here, but to your earlier question, this one does have a lot of drop down, or a lot of point 1, point 2, question 12, point 1, 2, 3, 4, 5. So it is longer, this is page 3, and, and there are more thoughtful questions. It does ask you for some actual fill in the blanks, some actual numbers, so number of kids screened.
Both this and the original profile, you print out the blank sheet beforehand.
Yes. Yes. So this is the quality.
You can print out the quality. Oh, sorry.
Yeah,
you can definitely print out.
You can print out the quality questions.
You can print out the quality and the sustainability. I'm not sure about the mental health profile, but I mean, it's
right.
This is. I mean, so I input all the information. I didn't have any problems, and I'm not like a super computer person, but like it's pretty user friendly, right. And that's what we did, is we printed it out because, we were just really just like having discussions about this and making notes and going back and getting clarification, and then putting everything in once we kind of short all that up. I'll also say that we did have one issue where we Michelle called me and she's like, "Oh my God, all of our data is lost." And I'm like, "What are you talking about?" It was just there. Like, I have the report printed out here. Like, oh my God. And so we're calling CHDI and we're saying, what do we do? And so they said, well, email technical support. And I'm like, okay, email, they're never going to email me back. It's gone forever. I'm so pessimistic about it. Yeah. And within like the next day, they had emailed me back to say it's resolved. All of your data is back, and it was. So, I mean, from my experience, it's user friendly, and the assistance that we received from CHDI and from the SHAPE system themselves has been, met expectations or beyond expectations.
So when you get through all of these, here's your tier 3 services and support. Again, some of these are fill in the blank. Some of them are 6-point Likert type scale. So sometimes it's just figuring out, okay, what does sometimes mean to us versus mostly, or So again, that's your process, doing it as a group. Yeah. When you get through the end of it, your box turns green. So now you've completed the quality box. You haven't started sustainability yet, but you go right up there to the top. You can get a certificate printed out with your star. And then here you see here actually first, the progress report is right here. You click on that link that tells you exactly all of your results. And then here are your resources, and the page goes down much further than this. This is just a short screenshot, but it has it by domain. So here are the domains, teaming, screening, all of these, and it puts it in priority based on your responses. So teaming must have been an issue for this particular school because that's kind of the first thing that came up for them as a resource versus, evidence-based services supports that's further down the road, and you see, resource mapping might not even be here, or they do have one for each. Implementation doesn't look like it's there. So maybe they were doing stellar on that and they don't need any immediate help. There's the certificate, again, progress report. Here's what some of the report looks like. This is your FACE page, and it gives you kind of an overview, an aggregate of composite scores, your average scores across each area. And it tells you where you're doing well. Mastery is green, progressing is yellow, emerging, that's where you need some help, right? And then if you put in any of these are based on the Likert scale, so the averages of those. Okay, got that. At the bottom, the other performance domains are the ones where you actually enter in text. And so if you entered in information there, it calculates a little differently. Here's another version of the next kind of a dashboard of your composite score and where you're doing well and not so well. So of course there's no greens here, so they're doing okay, but there's a lot of room for improvement for this particular school or district. Here, this is about evidence-based implementation, not doing so great here, right? A lot of red. And then there's kind of text based on the number of students that they screened. Here are the results they reported. And this is a tool that populates that you can use for strategic planning. So again, we talked about what do you do with this information, and what were your lowest scores? Where do you want to work to improve? again, here's the portal with all of your resources. Those are resource guides that look like this. These are two separate ones. So that's one whole page. This is another page with specific steps that you can work to implement. Once you get through that process, maybe you're ready to go on to the sustainability tool, right? And we do, again, to get Silver Star, you can do either or. We recommend that you start with quality. It just seems like it comes before sustainability. You can do sustainability without doing quality, but we recommend you start with quality. Again, starts the same way. And the domains on this one, let me remind myself what the domains for this one. Funding and resources, resource utilization, system quality, documentation and reporting impact, and system marketing and promotion. So a little bit different in terms of how are you using the information that you put in your quality system. And then when you get all the way through that, you get your gold star. Same thing, you get your resource library pops up. Again, this is if you have an account where you have, if you're an administrative level view, again, you don't have to be an administrator as your title, but for the SHAPE system, if you're the lead, you might have access to a school district level and schools. So this is what your view would be like, and you could click in wherever you want. Another thing that's really new and exciting that I think this debuted maybe in the fall is a tool around screening. And so if you look here on the left, you can actually, this is a searchable database that they have in the SHAPE system. If you want to find and select and use a screening tool for any particular issue, so you can search it by the purpose, the target, the age group, the language, who fills out the survey, the cost. All of these are free public domain, so anything you get on here you can print, you can use for free. And it will, again, give you a list of what meet your criteria for what you're looking for. And you can link to them right there and print them out. That is, it's kind of, yeah, you do have to print it out. Yes, correct. Yeah, you don't enter the information into here. Is that what you're asking? Or the, okay. Yes.
Getting a lot of kids to do an assessment reading.
Yeah.
Favorites, like they don't even know what favorite is.
True. Yeah, exactly. I know you may have to create a survey form if you wanted to do it electronically. Some of them do offer it. So again, that would be something you would look at if you were interested in a particular one, you wanted electronic. And then the last thing that I really want to highlight before we do like 1 minute of implications is another new piece that just came out, I think in January, this piece came out on the SHAPE system, is the Trauma Responsive Schools piece, the TRS. And so this is a tool specifically to assess how trauma responsive are you as a school or district. And the domains here are school-wide safety, programming, staff trauma knowledge, staff trauma skills, early intervention activities, targeted intervention, and staff wellness and burnout, secondary traumatic stress, which we know that doesn't get enough attention usually. And so all of these are also on a 6-point Likert scale. So that's a new piece that has been implemented. So just to give a couple of lessons learned from that we kind of all discussed, and please feel free to jump in. We mentioned this before, your results are only as good as the data you put in. So if you put a bunch of I don't knows, or you kind of put, well, this is the politically correct answer, this sounds good, or I think this might be what we do, just realize that when you get the report back out, that's the quality of your report. So the better, most useful information, most complete, and most honest information is going to give you the best reports out. It's really about the process. Again, can't express that enough, that it's really about kind of sitting together and saying, what do we know? What are we doing well? What are we not doing well? And who knows that information? How do we make this a team process? We have, that was one of the points you wanted to make about technical assistance, is that once you have the information, what do you do with that? And how do you...
Yeah, it's definitely, when you look at the report, I mean, I think even the process, like you said, the process is important, because even sitting together, we're like, oh, we're like maybe doing that, we're sort of doing that. Yeah. Somebody has that data, but we're not sure where we're tracking it. Yeah. So even just like having the conversation about it highlights some things for you, but then you get the report and you're like, oh geez, this is like, how do I read this? How do I make sense of it? So, so that's really helpful in having the technical assistance to kind of like say, okay, now we've compiled all this, what are we gonna do with it?
Yeah, the real work isn't actually in filling this out. Yep. The real work is in, so the commitment isn't in creating these reports. The commitment is when we get the results, what plan are we going to make? And that's kind of where the team that you put together, and that's why you have to be honest. Because if you're not honest in the answers, if you give the answer that you think somebody else in the room wants to hear, then you're not going to have a plan in place to fix what you need to fix.
So quickly, there's your next steps. Join now. Do your blue star today. Identify your team. Stars. Right? I know. I love stars. It makes me happy. Discuss your school and district priorities. So what do you want to get out of this? How are you going to use this? And make sure you know that going in so that it doesn't feel like, oh, this is just a chore to fill out this long survey. Silver Star status by July 1st. We can help you. So reach out if you are interested. Contact information is here in the slides, and use the technical assistance to complete the tool, but then also to use it and implement it and sustain it afterwards, and monitor your own outcomes and sustainability. So that is all we have for today. If there's any other questions, we're happy to answer them.